Hi, thank you, Chris. Thank you, Democratic Committee, and thank you, invited guests. I'm humbled and honored to be here, and a little bit nervous, so please bear with me. I'm not running for anything, and not used to public speaking. I did start in 1998 when I was working with Abby Cooper in the junior high and asked her how we could better take care of the people from a medical point of view down on the beach, because she was doing such tremendous work on a social work basis. She got me in touch with Patty McKenzie, who is your secretary, and at the time she was with the Hampton Community Issues Coalition, and we got together, and Bobby Preston, a very wonderful guy, donated some space to us down on the beach and got us in touch with all the people we needed to work with. Dee Goff, who was the school nurse at the Hampton Academy Junior High at the time, who was the first nurse down at the clinic, some 12 years ago now. A little bit of background. In 2003, the state of New Hampshire had 100,000 people without health insurance. And it's estimated that in 2007, the state of New Hampshire had 142,000 people without health insurance. And I imagine 2009, the numbers were greater. The number of unemployed obviously is greater. We're seeing unemployment numbers nationally this morning of 8.1%. A horrible, devastating thing. The thing that you might not know is that most people, though, who don't have health insurance are actually fully employed. They have full-time jobs. About 80% of people, it's estimated, have full-time jobs when they're unemployed. And a significant minority of them work part-time. There's only a small minority of people who don't have a job, who don't have health insurance. Of course, we expect that number to increase in the near future here in Hampton Beach anyway, and probably in the nation in general. Terrible, terrible news. The medical things that we do down there to help those people are actually, in my mind, a very small thing. It's a small part of what we do, and our patients are very grateful. Clients, I still call them patients, are very grateful, and the volunteers say that what we do on a medical basis is a very good thing. But frankly, swear to God, it's the smallest thing we do down there. There are 2 full-time social workers who help us down at the clinic. One of them is from C-Care. C-Care pays that social worker to come down and give us a hand. C-Care is a foundation, another nonprofit like ourselves, who try to get physicians together who agree to see patients on a very, very nominal fee basis, $5, $10, or $20 for a visit. And fortunately, most, to my knowledge, all of the primary care physicians on the Seacoast are part of that system. In town, you have a gem named Michelle Kingsley, who was the town welfare officer and a social worker of many years. And she is variously looked at as a prison guard and a mother and Blackbeard the pirate, but in fact she is incredibly fair and incredibly wonderful and incredibly dedicated and works all week long to fix what we mess up at the clinic sessions and to help people with all the other things that need to be helped. As the town welfare officer, she can send people down to the clinic, which is a great savings to them. We at the clinic feel very comfortable sending people back to Michelle for help with rent and medications and whatever we're not able to provide for at the clinic. We have lots of other volunteers. Peter Thomas is a dentist here in town who forever has never refused anyone, has never charged them a dime, and just says, bring them on. And we now have another oral surgeon in Exeter who's volunteered to help us. And Peter Thomas says, just bring him on. He keeps asking us to send those people to him. He's a wonderful man. We should be very grateful and thankful for him. There are others. Jim Dolan, a podiatrist, who just volunteered to come down to every clinic and help us from a podiatrist point of view. There is a 16-year-old Brazilian national who's a de facto volunteer at our clinic. If you don't know, there's a small but significant population of Brazilians in this area. They bus our tables, they plow our driveways, they help press our clothes, and do a lot of other things. Many of them speak only Brazilian. A few of them are bilingual. English is their second language. And whenever they are at the clinic, this young woman is always there. So everybody knows about Sylvia. And she is the interpreter. And we couldn't practice. I could not see these people without Sylvia. She is as important to their medical care, this 16-year-old kid, as I am to their medical care. And she just never failed us. We had to set up a stress test for someone this week. I have Sylvia's cell phone number, and she and I go back and forth. I try not to call her during school. And she helps me arrange to get people there and to get things done that need to be done for that part of the population. Budget. We have a budget of about $10,000 a year. We receive many unsolicited donations. The kids at Marston School roll pennies for us every year and send us hundreds of dollars every year. We receive memorial donations on occasion. The patients from my private practice are just phenomenally wonderful and extraordinarily generous. And as they say on public radio, and people like you, thank you very much again for what you're doing for us today. As to whether or not it's worth it, after Chris invited me to speak, I ran some numbers and very conservatively. Michelle Kingsley. I hope you didn't hear anything I said about it. I ran some numbers, and conservatively, just for the clinical interaction component of what we do, it's probably been more than $2 million on a conservative basis for what we've done. And that doesn't, yeah, surprise, I did those numbers this week. That doesn't include things like medicine. I'm familiar with a 24-year-old kid whose medicine was $900 for a 3-month supply, and it's 1 pill a day, by the way, so do the arithmetic. And he just received insurance, and his copay is now $50 for that same medication. So guess what? He can afford his medicine now, which is kind of a wonderful thing when he couldn't afford it before. So when you factor in the ancillary things that are done, the medications, the social work, the other things that go on that are really very far apart from the medical things that we do, the finances, the money is absolutely extraordinary. So that $10,000 a year investment is well spent. I don't think I have to tell anyone here about volunteerism. I think I'm surrounded by the greatest volunteers in the area. But one thing I would like to leave you with is that you don't need to be an expert to be a volunteer. You just have to have a passion, whether you're that 16-year-old Brazilian national or whether you want to go to medical school. The expertise comes, the wisdom grows from the passion that you exert on whatever it is you want to put yourself against. So with that in mind, thank you all very much for the donation. It's appreciated. Thanks for hopefully your continuing support of the clinic. I'll be happy to answer any questions later on.